Hello, students. This is the clinic paperwork video that you have all been waiting for. So we're going to get you all set up for clinic paperwork for spring of 2025. I see that all of you are at least in the hopper for CSD 490, so that's awesome. Make sure that when you are in there that it is section 1 and we're not looking at other sections because that's the one that Dr. Anderson gave you permission for. All right, in terms of clinic, so here it is. You've been waiting a really long time to get here, and we are excited for you to be able to apply what you've learned in the clinical setting. So a few tips is to keep all of your resources handy. So CSD 360 is a great resource. Make sure that you have that paperwork handy, and that will be crucial for you as you start writing SOAP notes and paperwork. It's a great reference. Once you find out who your client is and what disorder type they have, digging up that classwork is also going to be helpful. You're going to be scared. It's totally normal. You're going to have sweaty armpits that very first day, and it's going to be a lot. You're going to feel like you're not going to know what to say. That you maybe screwed it up, but you didn't. And if you do, it's not a big deal. That's how we all learn. We're always learning, no matter where you are in this profession. So hopefully you're excited and you're ready to tackle this last big event. In terms of paperwork, there are a few things that you are going to need, and I will attach those pieces to the email of this video. Some of those pieces need to be returned to me before you leave for winter break, and some of them can be turned into me when you return. So one of the things you're going to get is a practicum information sheet. Typically it's a green sheet, but because I'm sending it to you on email, it is not. It includes a calendar, and once you register, you need to put your schedule on that calendar and fill out the top portion and return that to me. So if you want to print it and write on it or do it digitally, I will take it either way. I will take an email copy as well. If you want to print it and return it in to me, you can do that as well. I will take it however you send it to me. A thing to keep in mind is if you are working, that if you put your class schedule in there and then the rest of it is work, it's going to be hard for me to schedule clinic for you. Once your clinic is set up, those are the days and times that you'll have clinic for the rest of the semester. So you can then tell your employer, hey, listen, that first week, I'm not sure what it looks like until I call my client. I can give you a guesstimate, and I should know by the end of the first week of school. Once that's on the schedule, then you guys are good to go for the rest of the term, and you can schedule your work around that. So if you have significant conflicts or questions about work, please come and see me so we can talk about that. So you're going to get that sheet. You're going to get a confidentiality sheet that you need to read and sign and return to me. This is important for you to know. It helps cover the health information that we have in our clinic. It gives you some word language for a tag on your email. And it helps you to understand that what you're dealing with when you're here in clinic is patient information and it is confidential. And we expect you to treat it with care and not to talk about clinic or clients outside of this space. And if you choose to do that and people discover that or paperwork is laying around, it will jeopardize your clinic grade. So we take our patients' information very seriously. So please read the confidentiality information form and then return that signed to me. I'll also include the dress code just for your information. We realize that the dress code comes from a patriarchal structure. So we try to look at the dress code as something for safety. If you have a small client that is a runner and you're wearing high heels, that could be really difficult, or that's why we don't wear flip-flops in the clinic. And sandals should have a back on them just for safety reasons. We also have cameras in our clinic and in the rooms. So Overhead views of you are prevalent. So we just ask that you have appropriate attire on while you're here. Don't roll in from the gym or from a run and come to clinic. We're trying to put our best foot forward with our clients and their caregivers. So read that over and make sure that you understand that. We will have a clinic meeting. One of the information pieces that you'll get in this email is our sort of your calendar of to-dos. We will have a clinic meeting that first Tuesday of the spring semester right after 352. So we'll meet in 024 and have a brief clinic meeting at that point. Okay. Again, professionalism, clinic is the best way to sort of practice all of those skills. Addressing your supervisor by their title, Ms., Mr., Mrs., or Doctor. That's how we address folks down here. That's how we address emails. I know that's not everywhere on campus, but that's how we do it. We're addressing client caregivers by their titles unless they tell us differently. Clients, we find out how they want to be addressed, especially if they're adults, when we meet with them. If you have an adult client and then they know your supervisor by their first name, they may ask you to call them by their first name. In that given situation, it's going to feel really strange, but it might happen. So just keep the professionalism piece in mind. The last paperwork piece is a background check. Some of you might have had this for Education 205. If you have one that's recent, within like the last 6 months, and you can get a copy of it, I will take that. If you don't, be sure to go into the Viewpoint and sign up for one for CSD. So that's also on one of the sheets that are attached to this email. Okay. There's going to be a Canvas course for CSD 495. I will make sure that you have access to that. All of the resources that you'll need will also be in this Canvas course. You will need to track clock hours. What is a clock hour? Anytime that you have contact with a client or are doing any sort of training with caregivers, that is a clock hour. So therapy for sure is a clock hour, and we need you to document that. So you might want to keep a log or an Excel sheet or a notebook of the days and then the time that you had clinic. And then if there were pieces like we did 20 minutes where we did evaluations or baselining, make sure that you note that so you can split that out at the end. We need to track your clock hours for the semester. So make sure you have a way to do that. We do use ClinicNote. This is our online medical records keeper. So you will need to pay for this. This is $30. It gets you access to all of your clients' information. That's where you will do your SOAP notes and your final therapy report. You'll get more information about that as we get closer to the semester. You will have access to the P drive and S drive. Those are secure drives here in the clinic. They can only be accessed down here in our lab. It's a great way for you to have shared documentation with your co-clinician or supervisor if they want you to do drafts in there before you transfer that to ClinicNote. That will be set up for you before you get here in the spring semester. So we'll again have orientation that first day at 5 o'clock in 024. So just plan for that on the 21st of January. Put that in your calendar so you can be here for that. We'll answer any other questions that you might have. I will send the clinic assignment roster the first day of school. What you will do is that you will go and find your supervisor, knock on their door and say, I'm so-and-so, you are my supervisor. And sometimes they may email you early and introduce themselves. Tell them who you are and that you'd like to get the name of your client. So you can either look at their file online or you can get the hard copy file from Christine in the office. So then from there, they're going to want to set up a one-on-one with you and your co-clinician most likely to talk about the first week, the first lesson, the first session. So introduce yourself, ask for your client's name, set up another meeting with them, and then that process for getting clients set up, what they expect of you, all of their paperwork pieces will come after that. So everybody's going to do it a little differently. So If you have Mrs. Weltzine and somebody else has Mrs. Nim, they just have different, they have a common syllabus, but they also have different rapports with kids. They have different approaches to clinic, and that's okay. That's okay. It's not going to all be the same. If your client cancels, I will be the one to try to find you a new client. I will work with your supervisor on that. If you have any questions along the way, please let me know. If after this video you're like, that was terrible, I didn't learn anything, I have so many questions, come and see me. I'm just tucked into the 038 now instead of in 036 where Dr. Anderson is now. So come see me. I still have candy. So I'm excited for you. I think this is going to be a really great high note for you to finish on, and it'll be a great way to end your time here at Stevens Point. If you have any questions, please let me know, and look over the paperwork that's attached to this email. That will have everything you need in it. Okay? All right. Have a great end of your semester, and we'll see you around.